Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology. Welcome everyone in our today's class. Today we will discuss about the routes of drug administration. A drug may be administered in various routes. The choice of the route in a given patient depends on the properties of the drug and the patient's requirement. So, appropriate knowledge about the routes of drug administration is very important. The routes can be broadly divided into two ways. There are systemic route and topical or local routes. Systemic routes include enteral route and parenteral route, and under enteral route drugs can be given in oral route, sublingual route, buccal route and rectal route. In oral route, most of the drugs are given in oral route. Paracetamol tablet, azithromycin, omeprazole, cefixime, these are the common drugs that we can give in oral route. Then we come sublingual route, drugs that are given just beneath the tongue. This is the route called sublingual route. The drugs that are given beneath the tongue is called sublingual route. Nitroglycerin spray and nifedipine gel that can be administered in this route. Buccal route, antacid tablet, vitamin C, these are the drugs we can give in buccal route, and in rectal route we can give diazepam suppository, diclofenac and paracetamol suppository. This is the drug we apply in rectal route. In parenteral route, it includes intradermal, subcutaneous, intramuscular and intravenous route. Intradermal, some vaccine we can give in intradermal route, and allergy tests are done in intradermal routes. Subcutaneous route, insulin and heparin, these are the we can give insulin and heparin in subcutaneous routes. And intramuscular route, injection pethidine, injection ketorolac and some other injection we can give in intramuscular route. In intravenous route, injectable antibiotics like ceftriaxone, metronidazole, thiopental sodium and infusion of fluid, infusion of various fluid we can give in intravenous routes. Then comes to the local route. Local routes means topical route and external application of drugs to the surface of the skin and mucous membrane for localized action is the topical route. And in topical route we can give drug above skin, in eye, ear, or we can use nasal preparation, nasal drop. In skin we can give cream or ointment. In eye we can give drop or ointment. In ear we can use drop and cream, and in nasal and in nasal nose we can give a drop or spray. This is a picture where a drop is applied on eye, and this is a spray which is given on nostril. In deeper tissue we can give intra-articular injection like hydrocortisone injection into the synovial cavity, and in deeper tissue infiltration, local anesthetics drug around a nerve, and in infiltration route, intrathecal and epidural. Medications and anesthetics are also given in intrathecal and epidural routes, and intracardiac adrenaline in cardiac arrest patient is used as a intracardiac route. Next come inhalational route. Inhalational route, in this route drugs are directly used in the bronchial tree, just like inhaler or nebulizer solution like salbutamol and ipratropium bromide. Now come to the advantage and disadvantages of various route. Advantages of oral route: it is the safe and most easiest way to given for or administer a drug, and self medication is possible, painless. This is the route is painless, and minimum monitoring is needed. no chance of local injury and less chance of hypersensitivity reaction. Then come to the limitations of oral route. Irritant and foul smelling drugs cannot be given in this route. Slow onset of action, so not suitable for emergency condition, not suitable for unconscious and uncooperative patients, and drug destroyed by gastric juice cannot be given orally like insulin and heparin, and drugs that undergo extensive first pass hepatic metabolism cannot be given orally, just like glycerol trinitrate. Now come to the advantage of sublingual route. In this route, self medication is possible and rapid onset of action, so suitable for emergency condition. Avoid fast pass metabolism and bioavailability is higher and not get destroyed by the gastric HCl or hydrochloric acid. This is a figure where drugs are given in the sublingual route. In angina pectoris, we use glycerol trinitrate, sublingual route. Now, limitations of the sublingual route. Irritant and foul smelling drugs cannot be given, and a large volume of drug cannot be given in sublingual route, and frequent administration is not possible because the drug will cause excessive salivation and the drug may be swallowed. Now come to the advantage of intravenous route. Rapid onset of action, so suitable for emergency condition, and 100% viability occurs in this route. Avoid fast pass hepatic metabolism. Irritant, foul smelling and unpleasant drugs cannot be given. Large volume of drugs can be given in intravenous route. Suitable for unconscious and non-cooperative patients, and suitable for patient with diarrhea and vomiting. Now come to the limitations of intravenous route. Self medication is not possible and required monitoring. Aseptic precaution is mandatory in this route. Increased risk of hypersensitivity reaction. Intravenous cannula related complications like swelling, local pain or venous thrombus can be formed. Now come to the advantages of subcutaneous route. Slow and sustained action, so prolonged duration of action. Self medication is possible. Irritant and foul smelling drugs can be given, and significant viability means viability 75 to less than or equal to 100%. These are the advantages of subcutaneous route. Now comes to the limitations of subcutaneous route. Large volume of drugs can be given. Discoloration of skin may occur. Atrophy, irritation, tissue necrosis to the site of injection may occur. Now comes to the advantage of intramuscular route. It is a rapid onset of action, a prolonged duration of action, a significant bioavailability, and irritant and foul smelling drugs can be given in this route. Now limitations of intramuscular route. Number one, it's very painful. Large volume of drug can be given. Self medication is not possible and causes local injury like hematoma, nerve injury at the injection site. Now advantage of rectal route. Rectal route is suitable for unconscious patient, infant and old age. Bad smelling drugs can be given easily in this route. Drugs are not destroyed by gastric acid or intestinal enzyme. Significant avoidance of first pass hepatic metabolism occurs in this route. Now limitations of rectal route. It is an embarrassing process. It hampers the privacy of the patient. This is a very common problem. Cannot be given patient with diarrhea. Fecal materials may interfere with absorptions of drug. Rectal inflammation or irritation can occur with repeated use of the drug. Now advantages of inhalational route. Rapid onset of action and less adverse effect in this route. Bypass fast pass hepatic metabolism. Can be used on demand. Drug is directly delivered to the site of action. Limitations of inhalational route. This route is not suitable for unconscious patient and special apparatus is required. Drugs can cause irritation in the airway. variable viability, viability may be 5 to less than 100%. Now come to the questions. If we tell please give 5 emergency routes of drug administration, then you will say intravenous route, intramuscular route, inhalational route, sublingual route and pararectal route. This is a very common question that is frequently asked in Viva board. So you should have a proper knowledge about this. So this is all about today, and thank you all. Welcome for our next session.